Okay, so we had a look at the customer care words with Gerry McGovern's team, looking at the COVID-19 World Health Organization's website, complex beast. So the job is to try and help people find what they need to find quickly and easily. So in round one, we got people to categorize where would they put the tasks, the top tasks that they're trying to find information. What are those tasks? How would you cluster or categorize them together into sensible categories? And then they, having done that exercise with a few thousand people, respondents, they then discussed it and refined it and found about 60% accuracy in round one, that people could find about 60% of what they were looking for, they could find easily and quickly. That's better than 40% would be the normal for this stage of this process. It's an iterative process, 2 or 3 rounds to go. This is round 2, so they refined and test. Now what they've done is taken the categories, and we're going to show you what it looks like on screen and ask people, respondents, again, to, there's a task, where would you look? So they're looking to see the design, how do people get on with it. Ultimately, they're going to try and get 80% by the end of 3 rounds. But let's just see. So here we are on the site. Welcome to the COVID-19 study. It will take 10 to 15 minutes. We'll only do 2 minutes of it. So continue. Let's go into it and have a look. So now we're going to be asked, basically, you're given a task number 1, 2, 3, 4, etc. And then you're asked, where would you put it? So let's have a go. This is the kind of research that has to be done. So here's task 1 of 31. How can you disinfect a workplace safely? Now, if you're looking for that information, where would you look for it in this menu system? Okay, how can you disinfect a work placement? Oh boy, where would you look? Avoiding infections, maybe? Okay, I'm going to say there, but somebody else might say somewhere else. So I think it's going to be in the avoiding infection. Task 2, find a study called the Epidemiological Analysis on a Family Cluster of COVID-19, whatever that means. So I think that's research. I'm thinking it's research. Is there a research one here? No. Oh, there is, yeah. Okay, so we'll put that. I think it would go into research. Somebody else might think it goes somewhere else. But we're looking ultimately to get to kind of 80% accuracy. So task 3, which groups are most vulnerable to COVID? So which groups are most vulnerable? Where would you look at that? Well, I think for me, I'll put them there. Some other people might put them there, but this is my answer, so I'd find it there. So basically, you go through these tasks. So task 4 is find advice on maintaining healthy family relationships. Where would you look for maintaining healthy family relationships? Could be avoiding infection, maybe symptoms, at risk. Blimey, that's a bit of a tricky one. Find advice on maintaining healthy family relationships. Advice on healthy family relationships. I don't know where I would put that. Wouldn't be news, wouldn't be outbreaks, wouldn't be at risk. So that's one that I don't feel would fit easily into any of these. Finding advice on maintaining healthy family relationships. So that's tips and advice. Viral survival, no. Avoiding infection, maybe it's in there. That's the only place I can think of. So I'm going to put it there. People might struggle to find that. We'll do one more. Have any drugs been approved for use to stop COVID-19? So where would you look for that in this menu? So I'd say news, maybe. Avoiding infection, possibly. Vaccine immunity. For me, I click that. Somebody else might click somewhere else. So this is the kind of detailed studies that they've got to do. And so it goes on, it goes. What does the government say about reopening businesses? Last task we'll do. So if I wanted to find out what the government's guidelines are about reopening your business, where would I go? Possibly education. News. Yeah, I'd look there probably. I'm going to look for news. I could be wrong. But we collectively put together a big enough group of people to decide on the percentages and say, does this help us find what we're looking for? So these are the iterative processes, and there'll be another open discussion on Thursday, this coming Thursday, for round 2, and then there'll be a round 3. So this is the process. So I wish you well. Take care out there. All the best for now.